The Trump administration expanding telemedicine coverage to Medicare and Medicaid patients, encouraging more virtual visits during the pandemic. Our next guest founded the telehealth company called Medici. He says up to 90% of doctors' visits can be done using your smartphone and telemedicine. And Dr. Clint Phillips joins us right now. Clint, good morning to you. For the people who are unfamiliar with telehealth, explain what you can do.
Telehealth is an amazing opportunity for 90% of patients who do not need to go into the doctor's office. For years, 3 to 4 million Americans have been sitting in a waiting room for a doctor's visit, traveling, parking, filling out bogus paperwork for a visit that could happen virtually. And this is a historic opportunity for patients to be able to download an app, invite their provider to connect with them, and instead of jumping through all the ridiculous hoops that you used to have to jump into to talk to your doctor, you can now do this incredibly easily from the smartphone, thanks very much to policies passed by the president in this last week.
That's right. And now Medicare and Medicaid does cover it. We all downloaded a telehealth application through our company over the last week or so. But the great thing is there are so many people, and you know this, Clint, there are so many people who don't have regular doctors. And so it's like, I don't feel good. Who do I go to? This way, you go to your phone and ultimately you're connected with a doctor. And I know that you went from 600 visits a day up to like 4,000 over the last week or two because so many people are interested in this, because you don't have to actually go in to see the doctor and expose yourself to all those people either in the emergency room or the doctor's office.
Correct. Doctors are scrambling to be able to understand how they're going to be able to take care of not just their patients that they're worried about COVID-19, but their patients that have got hundreds and thousands of different issues. How do doctors continue to be able to manage and deliver care to these people? With Medici, they have the ability to download an app today and start being able to invite and help their patients later in the same day be able to deliver virtual care. So it's a huge leap for providers to be able to deliver care, to invite their patients. For patients who don't have a doctor, they can go onto Medici, either invite the doctors they have or be connected to a doctor if they do not have a relationship, whether it's for COVID-19 concerns or a host of any other medical issues that they might be running into.